again, virtually, of course. You're an interventional radiologist. So for those who don't know and haven't seen you here on the show, what exactly is that?
Thanks for having me. Yes, I'm an interventional radiologist, and we are basically a minimally invasive surgeon. We perform procedures using imaging guidance that used to require an open surgery, but can now often be done through just a needle stick.
Great. And what are some of the benefits of interventional radiology? You just said, that needle stick. What else can we look forward to?
Well, by doing the procedures in a minimally invasive fashion, we are often able to achieve the same clinical results, with much less downtime and pain associated with the procedure.
Great. So what particular procedure would you like to talk about with us today?
Yeah, today I'd like to talk about uterine fibroid embolization, which is one type of procedure used to treat uterine fibroids.
Excellent. Now, what are the symptoms of uterine fibroids, just in case someone at home might be suffering and might not know it?
Uterine fibroids are benign tumors that occur within the uterus. They are very, very common. Some studies suggest that up to 80% of females can have uterine fibroids by the time they are 50. The symptoms of uterine fibroids are primarily heavy or prolonged menstrual bleeding, and at times this can be debilitating for females. It can also cause bulk symptoms, where if the fibroids get too big, it can actually cause mass effect in the pelvis and push on the bladder or any adjacent structures and cause problems in that way as well.
Okay, it sounds like it can be pretty painful and pretty uncomfortable. So how are uterine fibroids diagnosed?
So in addition to a physical exam, in which case your either primary care physician or OBGYN can detect an enlarged uterus, ultrasound is probably the primary way that these are diagnosed. We see masses within the uterus that are fairly characteristic for fibroids, and that tends to be the number one way they are diagnosed. After that, also either CAT scans or MRIs can be used as well.
Okay, so once we've received that diagnosis, how is this condition treated?
So there are a number of treatment options for uterine fibroids. It generally begins with some types of medications, either simple pain medications or hormone medications such as birth control pills can control some of the symptoms. If those medications are ineffective, then we move on to the more invasive procedures. And these can include surgeries such as a hysterectomy, where the entire uterus is removed, a myomectomy, where the individual fibroids are removed, or a uterine fibroid embolization, which is what I'd like to talk about today.
Yes, let's get into that a little bit. Tell us about that procedure in particular.
So remember that the number one symptom of uterine fibroids is heavy bleeding. And what we do with the fibroid embolization is we actually cut off the blood flow to the fibroid so that that bleeding stops. We thread a very tiny catheter the size of a spaghetti noodle through the artery, either in the groin or the wrist, to the arteries going to the uterus. Once we're there, we can inject particles which flow out with the blood flow, get lodged in the capillaries of the fibroid, and cut off the blood flow to the fibroid.
Wow, this seems like a better procedure than what we might expect if we wouldn't come to you guys. So what can we expect after the procedure is over? Is there pain? Is there anything that we can expect after that?
Yes, well, first of all, because we shut off the blood flow to the fibroid, women can expect an extreme improvement in bleeding symptoms. Up to 90 to 95% of patients will achieve a significant improvement in bleeding. And that's because we completely cut off the blood flow to the fibroid. About 80 to 85% of patients also get an improvement in the bulk symptoms, because when we cut off the blood flow to the fibroid involutes and shrinks. After the procedure, in many cases, females can have a normal or a heavy menstrual cycle for the first cycle after, but they really start to see the results in the next month. The one thing to look for after the procedure, which we take several steps to avoid, is a little bit of pelvic cramping after the procedure. We do several items during the procedure to try to reduce that as much as possible. But most women, by a few days after the procedure, are doing very, very well.
Great. Great. Well, Dr. Stratil, it seems like you guys at RIA really do what you can to make sure that everybody is really taken care of and comfortable throughout the whole procedure. How does it feel to be able to bring women, especially, this comfort after something that can be so painful and uncomfortable?
Yeah, it's amazing feeling. I can say, because we do this in such a minimally invasive way, the downtime and the side effects, such as, if you have a hysterectomy, that is a fairly major surgery where you have your uterus removed. And so women can keep their uterus, they can get rid of their bleeding symptoms, and it's really a good feeling afterwards.
Dr. Stratil, where can this procedure be performed and how can we get a hold of you guys?
Yeah, so the nice thing about this procedure is it can be done as an outpatient. It takes about an hour. We can actually do the procedure here in our clinic. We have a clinic in the Tech Center in Denver. We also have facilities in northern Colorado, in Greeley, where we can do these procedures. They can also be done in the hospital. If they want to contact us, the easiest way is to call our clinic, which is 720-493-3406, or you can look us up online at RIA Endovascular.com.
Great. Well, we really appreciate everything you're doing to help everyone out. And thank you so much for joining us on Coco today, Dr. Stratil.
Thank you for having me.
The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. Give RIA Endovascular a call. 720-493-3406 is the number. You can talk about your treatment options. You can also learn more at RIAEndovascular.com. They paid for their